So the innovation vision of Hancock Health in terms of our partnership with Arrive AI is really all about looking to the future.
At Hancock Health, innovation isn't just a goal, it's a necessity. In a world where healthcare teams are stretched thinner than ever, one Indiana hospital and one Indiana tech company are proving what's possible when innovation meets compassion.
So if we get a blood specimen, we're having to have volunteers because it's taking us away from our patients, and them trying to find a volunteer to even staff the cancer center has been hard.
Enter Arrive AI, an Indiana-based autonomous asynchronous delivery network. Dan O'Toole founded the company in 2014, a company built to move the world's goods securely, intelligently, and autonomously, providing full chain of custody, climate assist, real-time alerts, and more. It's a world first.
This is the first time that a robot and an arrive point have worked seamlessly together to create pickups and deliveries in a healthcare environment. We're so excited. We love Hancock Health and their desire to innovate and be on the cutting edge of technology. That's what's really big for us.
On August 1st of 2025, Hancock Health became home to 2 Arrive points.
Man,
we just did it.
Thanks, Steve. You're on the hook now, man.
One outside the lab and one outside the cancer center.
This is referred to as the AP3. It's the 3rd generation of the Arrive point.
Let's walk you through the process.
They open up our Arrive point using their own tags already. They drop off their sample. They close the door. This triggers an order. This robot here next to it picks up that order, operating completely autonomously, talking through our cloud and to our unit, opens the door, docks up, mates up, picks up the device, closes our door, heads right to the lab, does it in reverse, alerts the lab tech comes out, pulls out the tote, and the whole cycle continues.
No person waiting on the arrival, and no robot waiting on a person. Asynchronous and efficient. For staff like Clara, automation doesn't replace care, it empowers it.
That's amazing. It's neat.
For this unique end-to-end solution, Arrive AI partnered with Ottonomy, a ground robot manufacturer already operating within several hospitals.
I think robots in healthcare facilities is not something new, but here we are adding an additional dimension with the Arrive points. Whoever is a customer for robots, they automatically will move to our Arrive points as well, and the same goes vice versa. So I think it's very complementary, where the robots are handing off the items completely without intervention of a person to the mailboxes to and fro. So that has not happened in the past in any healthcare facility, and that's something which excites us and the customers as well. So it's a full-fledged system coming together, so that makes it special. Any clinician or a nurse walks about 15,000 to 20,000 steps a day, and that's a lot. So what we are trying to do with the robots is to minimize that number of footsteps which nurses or clinicians are taking right now, so that they can more focus on the healthcare or the patient care side.
The best thing is you don't have to. It's a magic. You put something in this box, and when you come back and open it, it's not there. It's kind of a magic, that I would say.
Together, Arrive AI and Ottonomy created the world's first autonomous handoff between a robot and an intelligent delivery point, the Arrive Point, a milestone in healthcare logistics.
And it was not until we got to know and be friends with the folks at Arrive AI that we understood that a place like ours could go down this path. And I will tell you, it is not until literally 15 minutes ago that the light bulb went on for exactly how revolutionary this is. Because in all of those big hospitals that have these robots, there has never been an asynchronous handoff of materials. And it never occurred to me that that was the missing link. So we watched history happen today, right here at Hancock Health, and I could not be more proud and more enthusiastic about it.
Within weeks, the impact was clear. Time spent running lab samples was cut in half, freeing up time for patient care.
The buy-in from the staff here is huge. They've already come to us with a bunch of ideas to make this even better, and we want to hear those.
This opens all kinds of doors. You can imagine that we're starting just with one route, but we've already been talking today about the other dozens of routes that we could have, and let alone when we think about taking this outside the walls of the hospital, because we have campuses all over this county. How we could make things change is just immeasurable.
As Arrive points are added, the potential for delivery routes multiplies. And yes, at scale, The network extends outside, connecting buildings across expansive campuses, creating a unified, asynchronous, autonomous delivery platform. Less time on errands, more time on patients.
What do I see happening from here? Everything. It's so exciting. Where are we going, right? I can't even tell you, every day I'm so excited. We are taking on the world. We're changing the world. We own all this IP. This is our space. We're going to execute. We're going to blow it up. Come on in, Arrive AI.